Hi everyone, my name is Alec Brenner and I decided to do my project on the issue of radioactive gas known as radon seeping into people's homes across the Midwest. This problem, as far as people affected, can affect literally anybody. There's a lot of the trends of it aren't really well known because recent studies study of it has been relatively recent, being in that most of the research has been done in the past couple decades. So this problem could have been ongoing for the last couple centuries, but our understanding of it really only extends to the past couple decades. And one of the main issues with this is that a lot of people don't know about it. You might be surprised yourself. And it's kind of surprising because it actually, research shows that it could have really dramatic health effects, such as it's expected to be dangerously high in over 10% of homes across the Midwest. And the effects of this are that about 7 in 1,000 people exposed to high levels of radon are expected to develop lung cancer, and that number actually jumps up to 62 out of 1,000 if they are cigarette smokers. There's not a whole lot been done about this, and that is actually one of the main focuses of this project for me, was that I tried to look into why governing bodies have kind of pushed us under the rug, or why other people don't seem so concerned about it. And I think that is the main focus of my essay. Personally, this is important to me because I grew up in the Midwest and all of my family lives in the Midwest, so I care for them, and I hope that this can be fixed or better going forward because I think it has the potential to really influence a lot of people. All right, so you may be asking, why has there been so little government interaction on this, or so few policy changes? And there's probably a few different reasons for this trend. I would say that foundationally, the US government works that the actions of the government reflect feelings and concerns of the people that they represent. So one of the main issues of this is that I feel as though a lot of people don't actually know that they should be caring about radon, especially in the Midwest, and so they won't bring it about as something they care about. They won't vote on it. They're not going to bring it to their officials to try and actually influence policy change. There's been no polling on this that I can actually find, but I think a good representation of this trend is that in Minnesota, for example, only about 1% of homes across the state have been tested for radon in the past decade, which is concerning considering that some estimates say that it could be up to 40% of homes in Minnesota are at least at the minimum risk level of radon exposure. Outside of this, just basically people don't know about it, there is perhaps a more sinister explanation, which is that there has been data that has showed that government officials are more likely to actually cater to the ideals of the more wealthy people. And in the case of radon, just to back that up, it actually shows that the top 2% of earners nationwide have about a plus or minus 15% ability to influence the probability of policy passage, which is quite substantial. And in terms of radon, this is important because the testing and mitigation processes for high levels of radon are pretty expensive. So if, say, wealthy people do get wind that this could be an issue, which could have happened, they will have no problem forking over a couple $1,000s to try and fix their home's radon issue. And so they're not going to feel too inspired to try and actually cause policy change and work for it and fight for it, because they will not have much of an issue actually paying for the mitigation. Now, as you may expect, the consequences to this can actually be really scary. There's a lot of people that are at risk of becoming severely ill or even dying, and the Wisconsin DHS actually estimates that up to 21,000 people may die each year just from radon poisoning or complications with it. And as I just talked about, since wealthy people will be more likely to afford testing and mitigation of radon, they'll be less likely to actually suffer from radon poisoning. And this is just another source of social inequality across the economic boundary, where rich people will experience better health outcomes than poor people, which is a trend that we've been seeing the entirety of this class, and there's all kinds of reasons for it in modern society, and especially in these Midwestern states that are some of the most divided on these terms in all of the Union. All right, so as far as current radon interventions, there isn't a whole lot policy-wise that is present in the Midwest. But I still think it's important to discuss, at least physically, how we fight radon when it's detected to be at a dangerous level in homes. And that is basically just a ventilation system that effectively sucks radon out of the soil or the foundation of the home, so it never has the opportunity to seep into the actual air in the home, causing issues. Now, the problem with this is that the outright testing for high levels of radon can cost anywhere between $30 to $250, depending on if you get a do-it-yourself kit off of Amazon or something, or if you have a professional company come and do it. And then if you detect that it's unhealthily high, you will have to pay on average between $1,500 and $2,500 to actually install the mitigation system, which is of course outside of the price range of a lot of people who will be affected by radon. Now, as I've discussed, there hasn't been a lot of policy change that has been proposed or even especially passed in the Midwest to actually combat the radon crisis. So I've kind of had to do a lot of the legwork, brainstorming, and trying to figure out plans that might work to actually get this passed. And I have a couple ideas. My first is that, well, basically my entire foundation of this is that I would like to start a nonprofit organization that basically works with members of the community to raise basic awareness, which is one of the problems. Which lack of awareness is one of the main causes of radon being able to go so unnoticed and so unfought by these Midwestern governments. I think that we can work through charities or fundraising events, and just basically get the word out about the dangers of radon. I think that just people having an idea that it's out there and to be aware of it and actually want something done about it is going to be instrumental in getting policy change at the government level. As far as the actual policy change that I'd like to see, I am really focusing on the subsidized testing and then subsequent mitigation, if it needs to be done, of rental properties and public buildings and even private buildings that are inhabited by a lot of the public, as this is something that is largely undone. Like there is turnover of rental properties where these are super old buildings that are in areas that could potentially be super high in radon exposure, whereas the people who are signing it have no idea that they should be worried about radon, and in many cases the landlord probably doesn't even know that they are putting their tenants in danger. So I think having this framework of subsidizing it from the government level, from the state government, will have a huge effect on the health of people, and I believe that it'll please everybody, the people who are renting, and as long as the landlords don't actually have to pay out of pocket, they will be pro this idea. Now, I think this also works with if we have these community discussions through this nonprofit organization that I proposed, because I think that many of the wealthier people who may actually own real estate and rent it out will be a proponent of this, because I believe that they will be a fan of the higher health level of the community, but also that they won't actually have to pay out of pocket for much of the testing and mitigation, which would be a reason that they would be against it. One of the things that I am worried about is that throughout these community meetings and discussions, that people of different socioeconomic statuses could actually fight with each other and be worried, that they might want to sustain their own group, so they would be worried that the poor will say that the rich are getting too much in benefits, or vice versa. But I think that having these community meetings will be imperative in actually working out the differences and coming together on a policy that they both agree on and they both are comfortable with, and overall gets a lot of support from everybody involved. And once again, you get a lot of support for this policy, and then the lawmakers are going to see it, and they're going to actually give it the time of day. They're going to pay attention to it and consider it serious, and then a policy change could actually be in the works and be probable, which is the end goal. And I hope that before too long, the government can figure something out to help fight the radon problem. Thank you.